Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor of the University of Kansas Medical Center. This is Open Mics with Dr. Stites. Hey, today we're exploring an interesting therapy. Okay, this is going to sound a little funny. External counter pulsation, or ECP. It involves devices similar to blood pressure cuffs that squeeze your legs and your lower body and can help improve blood flow and help form new blood vessels. This treatment is already used for cardiovascular health, but today we're asking if it can be used to improve the health of your brain. But first, we're going to start with morning rounds. CAR T-cell therapy, one of the big breakthroughs in cancer treatment, takes weeks to prepare. New data shows the University of Kansas Cancer Center is developing CAR T-cell therapy faster than the national average. Helping explain that is hematologist oncologist Dr. Mark Hoffman, the director of the KU Cancer Center's lymphoma program. Good morning, Mark. How are you?
I'm doing well, Steve. Thanks for having me on.
Excellent. Well, thanks for being on. We've talked about the CAR T therapy on this program before. Now, it's a form of immunotherapy that takes a patient's stem cells or immune cells, sends them to a lab where they are re-engineered to fight cancer, and then gives them back to the patient. Now, Dr. Hoffman, help us understand, first of all, how does that really work, and how much time and effort it takes to create these cells, and what our advances are like. Talk to us first. Tell us a little bit more about stem cell therapy, or CAR T therapy, not necessarily cell.
Yeah. So I think to understand the data and understand sort of what we're actually doing and why we've got a leg up on the competition, I think it's critical to understand how this is delivered. And so as you mentioned, what happens is that I see a patient, and that patient has a refractory lymphoma that we think would benefit from immunotherapy. And then there's a whole set of logistical operations that have to happen. We have to pull off the patient's native T cells, so they have to have a line placed, they have to go to a pheresis center, they have to have their T cells removed. Those T cells then get sent off to a lab and then commercially manufactured and get re-engineered to fight the cancer, and then the patient receives a low dose of chemotherapy, and then the cells are reinfused. So what we're talking about is something called brain to vein time, meaning when do I think about giving CAR T cells and when do they actually arrive and go into the patient's body? So there's multiple steps there that occur along that line. And what we've found from one of the manufacturers, so Kite is the manufacturer of one of the commercially available CAR T cell products that we routinely used for refractory diffuse large B-cell lymphoma, and they've shown in their internal data that our average brain to vein time is 23 days and the national average is 38 days. And you can look at this in a number of different ways and try and understand exactly where that time is happening. The manufacturing time is fixed. It's 15 days. That's non-negotiable. It's going to take that long to make product. It takes them that long to make product for us or anybody else in the U.S. So the big difference here is in the logistics. So we're saving 15 days compared to the national average. We're getting patients into pheresis faster. We're getting financial approvals quicker. And we're actually delivering therapy in a much more efficient manner compared to other centers. And so this is really a testament to the logistical networks of our teams rather than any type of medical or therapeutic advance. This is just simply that we're more efficient in care delivery.
Well, that is pretty impressive, and how it's speeding all these outcomes. Man, I am having trouble with words today, but that's really not new. So anything else to add to this story? It's a pretty remarkable story. As I hear it, I'm thinking, okay, patients are going to like it because it gets started sooner. I think it's going to impact survival potentially, because if you have someone with an aggressive lymphoma, wouldn't you want to get that therapy started sooner?
Yeah, no, the brain to vein time clearly has correlation with survival outcomes. It reduces the need for what we call bridging therapy, which is the treatment that you have to give someone between the time that you actually remove their cells and the time that they receive them. So the shorter that time is, the less time there is that the patient can have relapse of generally a highly proliferative disease. So in multiple different clinical trials, one of the main reasons why CAR T cells have failed has actually been related more to manufacturing issues and care delivery issues rather than the efficacy of the product. And so, I learned very early on in fellowship that most of oncology was blocking and tackling, right? So we look for those highfalutin plays, but most of this is just making sure that you're delivering therapy and that the logistical setups are excellent. So this is really a testament not to the physicians involved, although I think we can take some credit for the leadership of this. It's much more the people that are actually doing this work and the CAR T team that has been established that really takes all of this seriously and makes sure that these patients get processed as quickly as possible.
I hear you have some pretty good pharmacists.
Yeah, no, the pharmacy team is fantastic. Allison Appenfeller, who's been running the whole logistical team, is on this. And on top of it, the financial coordinating people are excellent. So this is really a group effort where everybody that we have on all levels has demonstrated a very serious commitment to these patients and understands that while their role may be talking to an insurance company, that what they're actually doing is saving lives.
All right, well, that sounds cool. Thanks for being on the program. You know, I'm just going to accuse you of one more thing. I think you're doing this because you like to say brain to vein. That's pretty cool. I just got to say it. I like it. Yeah.
We always choose good rhymes, Steve.
I like it. All right, man. We'll talk to you soon. Thanks for being on. All right, joining me at the desk this morning is a doctor and researcher who's asking if external counterpulsation, try and say that fast, external counterpulsation can be used for brain health. Now, Dr. Patrick Moriarty is an internal medicine physician at the health system and director at the Atherosclerosis and Lipidophoresis Center. I said that, Lipid Apheresis Center, here at the University of Kansas Medical Center. And just to say it out loud, he's also one of my team of doctors because I need a lot of help. And fortunately, he's been here to help me over the years. Also here are two dementia and Alzheimer's experts, Dr. Jeff Burns and Russell Swerdlow, are the co-directors of the KU Alzheimer's Disease Research Center. Great to have you all here, and it's good to have him here as well.
It's great to be here.
Yeah, it's good. All right, now before we discuss ECP, Alexis Del Cid has spent some time with you and your team. She's going to show us how it works. Alexis.
So what are you doing to me?
It's a valid question when you're Velcro wrapped from your waist to your ankles in what looks like giant blood pressure cuffs.
This device is called external counter pulsation, or ECP, and it's been used for the last 25, 30 years for patients who have chronic unstable angina or heart failure. What we're doing is increasing blood flow going back to your heart.
And the University of Kansas Health System doctor, Patrick Moriarty, hopes that this treatment one day will be used to also treat Alzheimer's and dementia, because the blood flow isn't just being pushed back to the heart.
But we also want to see how well it increases blood flow to your brain.
And Dr. Moriarty says his studies have shown a cognitive improvement in people who've done the therapy consistently over time. Jill Chadwick has volunteered to be our test subject, so Dr. Moriarty can show us how it works. She does not have heart disease, Alzheimer's, or dementia. She does happen to be the director of media relations and the medical news network here at the health system, and it turns out she's also a pretty good sport.
Why'd you agree to do this, Jill?
Because I didn't ask enough questions.
These 3 cuffs that are on each leg are synchronized to constrict up to 6 pounds per square inch.
They'll start at 1 pound of pressure per square inch and titrate up to 6.
It does actually feel good.
Well, going back to the brain, again, it's only 2% of our body mass, but it gets 20% of cardiac output.
And Dr. Moriarty says after the age of 20, blood flow decreases to the brain by 5% every 10 years. Jill is trying to process the sensation of this experience.
It was like left, right, and now it's like together. It feels pretty strong at one. My legs are getting a good massage.
Slowly, they begin the process of titrating up to 6 pounds of pressure.
Oh, there goes the left one. I'm like, what's coming next? I'm feeling it. Oh my gosh.
When it's time to stop the machine and set Jill free, she says she feels fine, just a little tingly.
Oh, and now everything is tingling. Everything is tingling. It's tingling.
Dr. Moriarty says now that all of his research and studies are complete, all that's left is to wait and see if the FDA approves the ECP machine as a treatment for Alzheimer's disease and dementia.
That's pretty awesome. I just have to say it out loud. Now, Dr. Moriarty, we just heard you say in the video that this is not a new therapy. So how often is it being used and who's doing it?
Well, like I mentioned, it's been used for about 20, 25 years, but not for this disease. It's used actually for, approved by the FDA presently for chronic unstable angina. It was used for chronic heart failure too, but it now is only used for chronic unstable angina. But cardiologists who swear by it, say it does work, we're not using it because the reimbursement is basically not productive enough to be valuable in a hospital or clinical setting, unfortunately. So we started using it for this different purpose, for the cognitive impairment, with Jeff Burns from the Dementia Center and Neurology Center at KU, and he supplied us patients. Where's the Jeff? 12 years ago.
Yeah,
we did a pilot of about 4 patients just to look at blood flow improved and if cognition tended to show improvement. And it was a pilot which showed improved blood flow to the brain, and cognition tended to that, but it wasn't powerful enough. And then we had this multi-center trial that included 190 patients over a 1-year period of multiple therapies, and it showed improvement, particularly in our diabetic population. About 40 patients were diabetic.
Interesting.
And every single diabetic on the device showed cognitive improvement, every single one.
Wow.
And unfortunately, the FDA is still not pushing forward. We're dealing with this company called Renew, which supplied the machines to us. They're out of Detroit, Michigan area. And they've not been very successful with the FDA getting this to the next level. And it's unfortunate because this technology is safe and effective and non-invasive.
It's actually relatively simple, right? I mean, it's not that
simple
hard. It's been around for
hemodynamics.
years.
It's exercising without exercising.
Yeah.
Because there are patients, as Jeff told me years ago when I first started talking about this, he has patients, they try and do exercise to increase blood flow to the brain, but because they're elderly and cognitive impaired, it's hard to get to that capacity of level of intensity of exercise to increase blood flow. And that he's always had problems with that. And I said, well, let's try something like this. And he liked the idea.
That's pretty cool.
But you know, when it comes to blood flow, there's something called pulse pressure or arterial stiffness. And when you have arterial stiffness, the blood flow to organs like heart, lung, and brain and kidneys are lost. And this machine has shown to increase pulse wave velocity, which means they're improving blood flow distensibility, so you're increasing blood flow to the brain.
That is pretty amazing. So now, Dr. Swerdlow, I know the brain needs a lot of blood for its health. What do you think about this? How's it going?
The brain needs a lot of blood. It needs a lot of oxygen. And you know, I really want to congratulate Dr. Moriarty on some real out-of-the-box thinking.
He's always been an out-of-the-box guy.
I can
I've known
tell
him for
that.
like 45 or 40 years or so. He's kind of out of the box anyway.
Yeah. So you know, this ECP, I can see a lot of things being induced by this. You know, I've heard that it increases new blood vessel formation.
Yeah, angiogenesis and arteriogenesis, yes.
So, you know, that obviously includes or necessitates changing certain chemicals like VEGF chemicals and things like that. So, you know, it's really you know, nice out of the box thinking. Yeah.
That's pretty good. It is out of the box. And Dr. Burns, you've worked with Dr. Marty, conduct a pilot study of these 190 participants. Tell us what you found.
Yeah, well, so this is a big study, a labor of love for Dr. Moriarty for a long time.
It is a labor of love. This whole lipophoresis thing that he does, radiophoresis is a big thing.
Yeah. So, but you know, the trying to answer this question, does it really impact brain health and cognition? Takes a lot of people and a lot of time. And so, Dr. Moriarty worked with the company Renew that he mentioned, and we did a 12-site study across the country, different sites across the country, and enrolled 190 people to see does it impact some key outcomes. And you know, and as he said, not quite definitive enough, but pretty convincing that we saw an impact in cognition and function, but not quite convincing enough for the FDA, but I think convincing enough to say, you know, a couple things. One, you know, targeting vascular health may be a viable therapeutic opportunity for us, and then maybe this approach could be something we add to some segment of our population of patients with cognitive impairment. Potentially, we need to do more work. But yeah. So
well, it looks relatively simple and pretty darn safe. Do you think this can be done safely at home, or can we have to always be in a clinic or someplace offering the therapy?
Well, presently devices do need an attendant to help assist because you have to use an EKG to hook up to the heart so you know when the patient's heart is at rest, that when these cuffs in the lower extremities are synchronized to that, so they have to constrict quite intensely during that time period. But there are companies I'm involved with, I know, are moving to make it a home device and portable. That's
I just
coming
think
down
that'll
the
be
road.
remarkable.
Yes.
What you could do at home, and you could offer this, hey, let's go to sleep, take a nap, and do your pulsation.
Right.
Some of the members of the company that I worked with do have one in their homes, and they are doing it.
And they
like
check it out, huh?
Yes.
They're all doing their own study. So,
Yes.
so
One of my patients actually on apheresis bought one for himself for home
Really?
because he has family history of dementia.
Oh my.
I'll tell you his name later.
Okay.
You know.
Well, does it? I bet I do know who it is. What kind of clinical trials is this going to take to prove the effectiveness of this device?
Well, obviously the one we did, unfortunately, didn't get to that level. But I would recommend, and I would love to talk to you guys about this. We need to get more patients that are specifically vascular impaired of mechanisms, such as diabetes, such as other things, besides maybe having an ApoE4 or whatever. But I think going to the vascular connotation of dementia, which is very strong, as you know, is a way to start, I think, and hit the highest mark of risk by using a device such as this potentially to improve it. You know those new drugs, the semaglutides for obesity?
Yes.
Mounjaro and so
You
forth?
bet.
They have now shown in a study of over 1 million people, multiple trials, that this drug in diabetic patients reduced the risk of developing dementia by 40 to 70%.
It's remarkable.
In this drug class, they still don't understand why, but this drug class actually improves vascular distensibility. So they reduce the stiffness of the arterial walls. And now they're doing studies specifically on diabetics. Are you guys involved with those yet?
Yeah, to some extent, yes.
With the semaglutides?
Mostly with the SGLT2 antagonists.
I think the GLP-1s would be the better mechanism of action. SGLT2s are good, but they have an effect on the bone marrow. They activate EPO, which increases RDW. If you look up red
So
blood...
make sure you say that for our audience, what you just said. You're using a lot of big words
Well,
there.
the SGLT2s activate the bone marrow to produce erythropoietin, which makes the body make more red blood cells. And by making more red blood cells, they increase something called red blood cell distribution with RDW. If you can look it up, it's a major player of viscosity, but also increase inflammation, chronic inflammation. It's a better, in fact, I presented at the ESC in London in September, one of these new drugs for lowering cholesterol called bempedoic acid. We showed that it also reduced RDW, and RDW predicted cardiovascular mortality, irrespective of CRP. So it's a great marker to look at.
So there may be a couple of new other ideas that would align
Yes.
with some of your
Yes.
treatment strategies you've done for Alzheimer's disease. Are you
Yes.
excited?
I am.
Okay.
I mean, one of the things that we've been learning over the decades is that what we call Alzheimer's is probably many different things. And I think over the next few years, we're going to learn a lot more. Now we have these blood measures that can help us really understand what's going on in the brain. And we know, as Dr. Moriarty mentioned, that vascular health plays a role in many patients, more than we suspected a few years ago. And so, I mean, I think this idea of, okay, we got lots of things going on, we need to go after lots of things if we're going to cure or slow or, delay Alzheimer's. And one of them is vascular health. And this I think is a big step in that direction of saying, hey, we can target this system of the blood vessels and see an impact on memory and thinking. And what we need to do is really, I think, replicate this in a similar size, maybe bigger study. And if we do, then, I think it's very promising.
I like that. So how would you address caregivers' hopes and concerns about where ECP is today and where it might be able to go, especially for our audience out there who might be thinking, I want to try that?
Well,
Can they get in a study? Is the study still available? What can they do?
no, the study that we have finished a few years ago.
Yeah.
So no, it's not. But listening to my colleagues here today and their interest, I think there might be something down the road that we could look into,
I like it.
and we can
I'd
talk
say
about
exercise.
And I know
You
you
know,
can kind of do
always-
exercise,
Yeah.
exercise, exercise.
You can squeeze those leg arteries by walking and running,
Yeah.
and
Right.
but if you're struggling with that, yeah, we're working on other ways to try to get the benefits of exercise.
like
and this
that.
is one, it's a little more targeted than exercise is much broader
Yeah.
and hits a lot more things, but this one really goes after the blood vessels.
So maybe you can just squeeze the neck or something on this.
No, we don't.
All right.
No, maybe for you, I'll try.
Why am I not surprised you offered me that? All right, we're here to answer your questions. Send them to using the links on your screen, YouTube, Facebook, or email the Medical News Network. Let's check in with Doc Hawk. All right, sir. How are we doing so far? Respiratory viral season is upon us, and yet it's not really here yet. It's still kind of quiet.
It is kind of quiet, but I think nationally and locally here, we are starting to see an uptick. Not as much with COVID as, again, we knew that in the summer there was that larger spike in activity, and then it has decreased. However, I think we are starting to see a little bit more influenza activity around the nation, around our community, and in our hospital health system as well, Steve. So.
All right, so it's starting to jump up then. So the percentage of positive flu has jumped up a little bit, as you've mentioned.
Yep.
But so far, COVID RSV, what do you think?
Yeah, you know, I think hopefully for COVID we can keep those numbers down. Again, we know there is going to be any seasonality to this infection, particularly COVID-19 that I'm talking about here. Any seasonality, like I said, we saw it in the summer. Currently, it is in a lull. There is a more of a dominant form, the XEC variant. I think the latest WHO statement said, or World Health Organization statement said that it doesn't look to be any more dangerous or significantly increase the burden of infections or health system resources for that. But again, we know now that influenza is increasing. We've had a smattering of RSV as well. There is still time to get vaccinated, so I would encourage everybody to get vaccinated. Get your influenza vaccine for this year, get your updated COVID vaccine, and get your RSV vaccine if you fall into that recommendation category. But overall, I think we are going to now start seeing, especially as we enter into the Christmas holiday season, where people will be going to parties and get-togethers more now, increasing influenza activity as well, unfortunately. So it is important to have a plan. We know that there are home tests available for that. Also talk with your medical care providers as well if you start to have symptoms and need to get tested.
All right, so two headlines for H5N1 or bird flu. The USDA began mandated testing of unpasteurized milk.
Yeah.
Because a second child in the Bay Area in California was infected without a known source. And we've seen a few cases like this. We can't identify the source. What do you think is going on?
Yeah, interestingly, going to that second point with the child in California, so far we should state that from the beginning of the year, 2024, in the United States, we have seen 58 cases of H5N1 avian influenza in humans. Again, the vast majority of these patients are either dairy farm workers or poultry farm workers, so they have known exposure. There have been a very few number of cases without obvious exposure. Obviously, there was that case in Missouri that we learned about, and now this child as well. They were able to get some of that genetic material of that influenza, and I would like to say that from the initial reports, it doesn't seem like there was any major mutations that would cause it to spread from human to human easier. And I would say that from the rest of the United States cases of human H5N1 influenza, we haven't really seen any human-to-human spread either. So right now on that front, it looks good. As far as the testing of the milk, I think this is a good mandate. Again, this is a new mandate from the FDA. This is really looking to keep everybody safe. So they are testing raw milk before it gets pasteurized. They will do it it's mandated on request by the FDA. So anybody who is producing milk or in the bulk carriers or distribution of milk, they can be mandated to report this. This is very important, again, number one, for consumer health, but also for the farm's health, economic health, the health of the workers on those farms, and it will help the FDA and the government more easily identify areas of concern and then implement those biosafety measures to quickly more eliminate that and save other herds and other farms. And of course, when we talk about economics, it is vitally important that those farms, those farmers, those farm workers are healthy so they can continue to have economic health as well. And so I think it will help and aid in all of that.
Now, I think there's a little bit of concern with H5N1, the bird flu question. I mean, it doesn't look like it's especially terrible for patients. They don't get that sick, the humans have had so far. But yet, if we start seeing a lot more transmission between animals and humans, the chance for mutation rises.
Yeah.
I think that's the fear of where we could begin seeing a virus that may be highly transmissible then also cause more damage.
Yeah, you know, I think that's right. I think, again, the case in Missouri, they didn't find it until after the patient had already gone home and they had done some testing that was in process prior to that patient going home. This child here as well, there has been a critical illness in a teenager in Canada, but we don't really know any more details from that. But to your point, we haven't seen the critical illness. Most of the symptoms that these patients do have that are reported really involve the eyes and what we call conjunctivitis. There is some upper respiratory tract disease, but I think you're exactly right. To your point, Steve, we haven't seen a great amount of critical illness from this disease, and that is a good thing for sure. But the concern is if you are now having this virus in other mammals, particularly in cows or even in pigs, which we know can also be infected with other human viruses, is that potential there for mutation or mixing of viruses, which makes it now easier for H5N1 to infect humans. And so I think it is vitally important to continue to be vigilant, to do the experiments, to do the investigations, and keep a wide net for looking at these things so that we can help reduce that chance of happening.
Yeah, it makes sense. We should just remind our audience that the rules on infection prevention and control still travel with you no matter where you go. If you want to stay safe, you know what to do.
And, you know, I think that is the most important point. I'm speculating here, but I would venture to say that the vast majority of these poultry farm and dairy farm workers that have been infected may not have been by respiratory methods, but because they are working. It is very difficult to wear appropriate PPE, especially in those hot conditions, but also they may not be washing their hands frequently. We know that humans touch their hands into their eyes, their nose, their mouth frequently throughout 10 minutes. And so if you're doing that, you're not having adequate hand hygiene or frequent hand hygiene, it is very easy to get those viruses, those infectious viruses into your mucous membranes, into your eyes, into your nose, where we know it can cause infection. And so I think when you are out, when you are shopping, when you are out at gatherings, please be very vigilant to use frequent, adequate hand hygiene with either soap and water or those alcohol hand sanitizers as well. That will help and be the biggest part in reducing your chance of getting infected with these viruses.
All right, thanks you, sir. All right, let's head to Studio B with Alexis to see what our community is asking. Alexis, Merry Christmas, Happy Holidays, and all those good things.
Happy Holidays. I love your tie, Dr. Stites.
You know, looking at the red, and of course my red may say, Go Chiefs!
Matches perfectly. Hey, hats off to our boss, Jill Chadwick, for letting us use her as the test subject for the counter pulsation device.
That was pretty impressive. I have to say that. I was going to ask her. It just felt like a really rapid massage or something.
I know. It looked like it would feel really good. She said she was tingly after. Jeremy Yenser has a question. Jeremy wants to know, why does the blood flow decrease as we age? Are we just not utilizing it as much so our heart doesn't give it to our brains, or do our bodies just get less efficient over time?
Good question. Our arteries age, and
we all age. All parts of our body
right.
age. Yeah.
It's a process called hardening of the arteries, old age, or arterial sclerosis, not atherosclerosis, which is the abnormal depositing of so-called bad cholesterol within the arteries. In arteriosclerosis, the media, which is where the muscle and elastic tissue reside, becomes hard and stiff. So the arteries become like lead pipes, and they don't have distensibility. So the pulse wave velocity, which is the speed of the pulse coming out of the heart and the blood vessels, increases. And by increasing that, you increase the speed of the pulse to the organ, like the brain, the kidney, and so forth. And that pulse comes back faster to the heart and impedes blood flow coming out of the left ventricle. So it decreases blood flow to the brain, but it also puts stress on organs like kidney and brain and wears them down by this process of hardening of the arteries. So as I mentioned earlier in my video, after age 20, this process begins. Every 10 years, your blood flow to the brain decreases by 5% for almost all of us. Unless you have other diseases such as atherosclerosis, hypertension, diabetes, which, as we talked about earlier, type 3 diabetes is dementia, because the blood flow with diabetic patients is greatly impaired by their damage to the arterial wall. They lose this endothelial function.
Stu has a question about Alzheimer's drugs. He wants to know how many drugs are currently available for Alzheimer's, and are there any more nearing approval?
Team.
Well, we have the traditional drugs that have been around for 20 to 30 years, which are two sort of classes. One of them best known as Aricept or donepezil, and the other is Namenda or memantine. And then recently we've had approval of 3 drugs, 2 that are on the market, that go after amyloid buildup in the brain, and those are infusion drugs that we are still, that we're beginning to prescribe to a subset of our population of patients with early Alzheimer's disease. So that's an exciting step forward. And is there more coming? Yeah, there's more coming. Is there any on the really near horizon? Not that I can see. But maybe a couple years out, we're hoping that we got a lot of trials going on all around the world, testing a lot of different things. And so we're hopeful that a few of those are going to hit. And if they do, it's really going to have an impact.
You better get that accelerated because, Moriarty, I think, how much older than I am? We got to be worried about it. So, what excites you the most, Russ, what's coming?
Well, I think just understanding what really is breaking down in Alzheimer's disease. And when we figure that out, we'll figure out how to fix it. And that's going to be the solution. And I suspect it's going to come down to brain aging. When we figure out how to arrest and reverse brain aging, we'll solve this. And I think that brain aging is related to metabolism, and I think so. Things like what Dr. Moriarty has proposed here is, shake up metabolism a little bit. Interesting to see what happens.
Yeah, I love it. All right, Alexis, back to you.
Denise has a question for Dr. Moriarty. Dr. Moriarty, Denise wants to know, what if the person getting the counter pulsation happened to have an undetected blood clot? Would that be dangerous?
No, not necessarily. It wouldn't. I mean, if someone has an undetected blood clot, this should actually improve it, depending on where the location is in the patient.
You're not worried about breaking off at the pulsation and traveling?
No, I mean, these patients that we have are already on blood thinners if they have problems related to coagulation disturbances and so forth. But we've had, in our studies of many years, we've had no complication whatsoever outside of the tingling from your associate after her treatment. Most of them find it very relaxing by the blood flow that it entails the rest of the body.
All right, this has been a terrific discussion, and I am absolutely grateful to all of our guests for being here and for letting me mess with them a little bit up here. I always enjoy doing that too. Let's hear some final thoughts before we go. Dr. Swerdlow, let's start with you.
Final thoughts. Looking forward to learning more about this technique and seeing the paper I get the impression that you guys have known each other for a long time.
Oh my God!
Oh God!
When did you get here?
Oh my God!
How long did you
that
get
was
here?
like 1990.
I've been here since '90.
Yeah, around the same
We
time.
go back together for a
about the
long
same
time. Yeah, it's been a long time. He was one of the first primary care doctors here at KU for my dad a long time ago.
Well, I can see that you guys get along quite well. It's kind of fun to watch.
Sometimes
We've had problems.
That's just part of the deal after 35, 40 years, whatever.
Yeah.
Final thoughts.
I guess I would say that this is a good example of how we're sort of creatively thinking about brain health and dementia and trying lots of things, and that's what it's going to take. A lot of different approaches, testing a lot of different things to cure this disease or prevent it.
Yeah, I believe that. All right.
Well, I'm just happy that we got together to talk this over. I'm very enthusiastic about future endeavors of research in this field with you guys. And maybe with you, Steve, who knows?
Yeah, well, I just am an N of 1, man. I probably just need it.
Well, we can use you in the study, man.
Call me when it comes up. I'm there.
Well, I've heard talk that you probably need it soon, so
Yeah, you wouldn't be the first one.
But thank you anyways.
Hey, listen, you know the great part about Show Me the Science is when the science is on the table and then the scientists start having a conversation and you guys start thinking of new ideas. And at the end of the day, that's why we're here at an academic medical center. And for our audience, you saw science in action today. You got to hear about the studies, you got to hear about a result, and then you watch the scientists start talking about, hey, what do we do this? Can we try that? Can we try that? You know what? That's how we get this done. That's how we try to live long and prosper, by tying together faith, hope, and science, and help you live a better life. So thanks again to all of our guests and to our audience. We'll see you next time. Have a great week.
Dangerous blockages requiring open heart surgery discovered by an eye doctor. I'm Alexis Del Cid on the next All Things Heart, why doctors say a routine trip to your ophthalmologist can be life-saving.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.